Everybody, my name is Dr. Scott Giacomucci. I'm the author of Trauma-Informed Principles in Group Therapy, Psychodrama, and Organizations, Action Methods for Leadership. And today I want to talk to you a bit about trauma-informed principles in psychodrama specifically. So in this video, I'm going to go through content from chapters 5 through 10 in the book as it relates to the 6 trauma-informed principles outlined by SAMHSA and how we can be implementing them in our psychodrama practice to make the method safer and more applicable for trauma survivors. And this information is really relevant for any of the experiential psychotherapies. I want to talk about this first trauma-informed principle of safety as it relates to psychodrama specifically. And there's lots of different ways we can cultivate safety in psychodrama. And because of the experiential nature of the psychodramatic method and the power of it, it's especially important that we're attending to issues related to safety. In the past, many people were using psychodrama in ways that were not so trauma-informed, and were not attending to safety in groups or doing things that really disrupted safety for people in the group, which makes it that much more important that we're attending to safety in our psychodrama practice. Some of the ways that we can cultivate safety in psychodrama is through a longer and more gradual warming up process. In some of my research, I found an inverse relationship between spontaneity and traumatic stress. And from psychodrama theory, we know that we only access spontaneity through a warming up process, which suggests that trauma survivors might need a longer and more gradual warming up process in our psychodrama groups than when we're doing psychodrama groups with others that's not focused on trauma. Using more sociometry can really help with cultivating safety, and employing strength-based roles and other safety structures within our group and within our psychodrama enactments can really help cultivate safety. So we can develop safety by creating opportunities for smaller group interactions, by maybe starting with shorter psychodrama enactments with just 1 or 2 other roles and working our way up to longer, fuller psychodrama enactments. We can even keep it really simple and direct and suggest that there's a role for safety within the psychodrama scene, and that somebody plays the role of safety, and that we check in about safety, that we reverse roles with safety and have the protagonist share what safety means to them and connect with a sense of safety and remind themselves that they're safe through that role throughout the process. Using strength-based roles, whether it's the role of safety or the role of courage or the role of love or humility or some sort of interpersonal support or transpersonal spiritual role, really helps establish safety. I like to think of strengths as the building blocks of safety, in that strengths provide physical, emotional, social, and symbolic markers of safety throughout the psychodrama process when we have strength-based roles present. It's a constant reminder to the protagonist of their ability to access support and safety when things get tough in the psychodrama. Another role that can really help with safety is the role of a double. And what I mean specifically here is not just the one-off doubling statements from the director or from participants in the group, but using the role of a double, enrolling somebody in the role, and having that double stay with the protagonist throughout the entire psychodrama process. There's lots of different types of doubles, but generally speaking, they all will stay with the protagonist, be attuned to the protagonist, and their job is to make statements that label what the protagonist might be experiencing or feeling, or to help the protagonist become more aware of their body and their environment throughout the process. Other ways that we can cultivate safety in psychodrama include maintaining attunement to each individual throughout the entire group process, not just the protagonist, not just the role players, but also the audience member. Spending the time to develop our therapeutic relationship with the protagonist, and leveraging other supports in the psychodrama for the protagonist and for other auxiliary role players or audience members, especially if it seems like they might need some extra support. In terms of maintaining safety in psychodrama, it's also important that once we get our contract for the session, that first of all, the contract is really bite-sized and realistic, but that we stick to the contract, that we don't change the contract midway without consulting with the protagonist and really consulting with the rest of the group who chose the topic if we did it as a sociometric selection, but that we make an agreement about this is what the issue is, this is what our goal is for the psychodrama, and here's our plan of what we might do, and we stick to that contract as much as possible. This really helps the protagonist feel a sense of security in what they're about to do and what they're about to experience, and not be caught off guard by us taking it in a completely different direction and going for a different topic, a different goal, without explicitly renegotiating the contract with them. The psychodrama conference this year in New York, I heard a psychodramatist, Scotty Ermy. She said in her workshop, "The protagonist does not owe you a catharsis." And I really liked this quote. And I find this really important for us to remember. Of course, psychodrama can be very cathartic, and many times we might fall into the trap of believing that catharsis is cure, and that if we didn't have lots of tears and use lots of tissues in the session, that it wasn't a good psychodrama. This isn't true. Trying to provoke catharsis within individuals is not a good way of, and not a good goal. Catharsis, of course, is often necessary to get through blocks and to let go of feelings and express what's going on for us, to dispel, to let go of, to release something that's been blocking us off. But catharsis is only promotes lasting change if there's some sort of integration after the abreactive catharsis, some sort of learning, some sort of role training, something future oriented, some sort of new perspective or insight that we integrate after the catharsis and the letting go. This is actually explicit in psychodrama theory. In Moranian philosophy, Moreno actually contributed pretty significantly to our understanding of catharsis, and he talks about all sorts of different types of catharsis and factors that contribute to catharsis. But in this context, I want to highlight, he talks about abreactive catharsis and integrative catharsis as two different types of catharsis, and that the goal of psychodrama is to get to an integrative catharsis after the abreactive catharsis. Of course, there's other ways of maintaining safety in a psychodrama. We need to attend to issues related to identity and related to connection, cohesion within the group. And the process of cultivating safety in psychodrama is going to look different from group to group. I want to challenge you for a moment to consider, as a psychodramatist, how are you actively cultivating safety in your groups? And how will you know if enough safety has been cultivated to move forward towards the contract and the goal that you've established with the protagonist in the group, especially if it's trauma related? Are you utilizing strength-based roles to keep the group and each group member safe? Are you utilizing a long enough warming up process? Are you utilizing doubling? Are you providing the protagonist with options throughout the psychodrama? This is another simple thing you can do. Something that I've gotten into the habit of is I'll start the psychodrama by integrating strength-based roles. What's the strength that you need in order to achieve this contract, to face the trauma that you wanted to deal with today? Now I need courage. All right, pick someone to play the role of courage. We have a conversation with courage. We reverse roles with courage. We reverse roles back. The protagonist takes in the support from courage. Maybe we have another strength-based role. Maybe they have a double come in. Maybe there's some sort of social support, that some sort of interpersonal support. And then I might offer options to the protagonist once we've established safety and some support for addressing the trauma. I might say there's multiple different ways we could do this. Do you want to enroll yourself as a child and talk to yourself at the time of the trauma? Do you feel like you're at a point where you need to express anger to the person, a parent who wasn't there to protect you at the time of the trauma? Do you feel like we need to pull out an empty chair and tell the person who hurt you how much they hurt you and to really reclaim some power back from this perpetrator? Do we need to look at how the trauma has been internalized within you and address it in that sense? Do we want to concretize the trauma and deal with it in a more tangible um, way rather than enrolling it? Do we want to talk to yourself in the future and get some guidance around addressing the trauma? There's so many different ways to meet the same contract within a psychodrama related to trauma. And there's lots of ways to meet a contract and promote healing without reenacting the trauma scene. I would argue that most of the time we don't need to reenact the trauma scene, that by the very nature of trauma and traumatic stress, the client is naturally re-experiencing the trauma, especially if they proposed a topic and proposed to be the protagonist and mentioned the trauma in their protagonist selection and in their contract. It's already going to be up for them. One of the symptom clusters of PTSD is intrusions and re-experiencing. So if the protagonist is already re-experiencing the trauma internally, we certainly don't have to re-experience it externally again. There's a time and a place to do that, and there needs to be lots of safety and safety structures implemented for the protagonists in the group. Keep them in their window of tolerance if we're going to go that route in a psychodrama. Usually, that's something we would do further along in somebody's trauma recovery if it was necessary. But there's lots of ways to heal trauma in psychodrama without doing that. And my inpatient research on PTSD and psychodrama is good evidence of it. In our inpatient psychodrama group, people are in the hospital. They're only going to be there for 2 to 5 weeks, and they're in treatment for stabilization. So they're often at the beginning of their recovery process. It's not the time to do a psychodrama reenacting trauma. Instead, almost all the psychodramas and psychodrama roles are strength-based, or we might bring in one antagonist role after building up strength-based roles, or do grief work, or a little bit of inner child work. The outcomes in that group show an average decrease in PTSD by over 50%. So the average person who participates in that inpatient group within the inpatient program and completes the program successfully experiences a 50% decrease in their PTSD symptoms. That means a majority of the people who met criteria for PTSD when they started the group and were admitted to treatment no longer meet criteria for PTSD diagnosis when they discharge. So that's evidence right there that we don't have to reenact traumas all the time in our psychodrama groups in order to promote healing from trauma and to reduce PTSD symptoms. So I really encourage us to reflect on this and the importance of safety in our psychodrama practice. So again, this is just the first of the 6 trauma-informed principles outlined by SAMHSA and in chapter 5 of my book on trauma-informed principles in group therapy, psychodrama, and organization. Of course, we can't fully cultivate safety and address this trauma-informed principle if we're not also cultivating the other 5 trauma-informed principles. They really go hand in hand. So the second trauma-informed principle of trust and transparency is also really important in psychodrama specifically. And as psychodramatists in our training, we really have to learn how to trust the process in psychodrama. I think this is particularly important to psychodrama directing because there's so much spontaneity and so much co-creation that happens in a psychodrama When I facilitate a psychodrama, I often go in the group with only a warm-up and no idea what the topic's gonna be, who's gonna be the protagonist, or what the roles in the psychodrama are gonna be. And the whole psychodrama is spontaneously co-created with the group, with the protagonist, and with me. And so to walk into a group without any certainty on what the content is going to be and what the process is going to be exactly requires us to really trust in the method we're using and to have faith in the process. Of course, we need to trust the protagonist and to trust the group as well. In classical psychodrama, there's a popular saying to follow the protagonist. And I think this is usually a good rule of thumb, but sometimes it's limited, especially when we're working with trauma survivors, where we might get pulled into the trauma vortex sooner than the protagonist or the group is ready to. And we might have to provide some structure and some containment rather than blindly following the protagonist every single time. So instead of follow the protagonist, I've been suggesting a new motto, which is inspired by a motto in dyadic developmental psychotherapy. And this motto is follow, lead, follow the protagonist. That as psychodrama directors, we need to follow the protagonist. The psychodrama is about the group and it's about the protagonist. It's not facilitator centered, it's group centered. So we certainly have to follow the group and follow the protagonist. But we also have a responsibility to lead the group and to lead the protagonist, to keep the process safe, to provide options, to provide a container, to provide safety. So follow, lead, follow the protagonist feels like a more accurate and balanced motto for me than simply following the protagonist. As psychodramatists, we have to trust in the spontaneity and the intelligence within the group, and to trust in the tele within the relationships. Tele is a unique sociometry psychodrama concept, which is discussed in other videos on this channel. Essentially, it's the opposite of transference. It's a two-way accurate knowing and seeing and experiencing of another person. It results in synchronicity and in wholesome connections within the group, and people ending up at just the right place at the right time in the right role for the protagonist, but also for themselves. So as psychodramatists, we really have to learn how to trust the tele within the relationships in the group. We also have to learn to embrace uncertainty in the process. If we're too structured and too rigid, then we're not leaving room for spontaneity. There's a certain aspect of uncertainty that comes with facilitating psychodrama and leaving room for spontaneity. As a director in a psychodrama, we have to remember that we don't have to have all the answers. We can collectively work with the group, work with the protagonist, work with the roles in the scene to uncover answers that the protagonist is seeking. So this can take a lot of pressure off of us as directors, in that we can, when a question emerges, we can ask the protagonist, hey, I'm not sure where we need to go next as the director. Where do you feel like we need to go next? We could ask the group, hey group, where does it seem like we need to go next in order to accomplish our goal? Or we can even ask the question in surplus reality to any of the roles that are enrolled within the psychodrama scene. So, for example, if God is in the scene and somebody's playing the role of God, we could have the protagonist ask God what they need to do next. And we could even have the protagonist role reverse with God and become God and answer the question through the role of God for themselves. So we don't have to have all the answers. We can trust that the answers are within the group and can emerge from the roles. As psychodramatists, we use sociometry to cultivate a sense of trust in the group. And we can use both sociometry and psychodrama or sociodrama to cultivate transparency in the group and to deal with issues related to trust. So sociometry is really useful in that it helps illuminate some of the unseen and unknown connections, preferences, choices, identities, and experiences within the group. It helps reveal the group to itself. So sociometry is particularly useful in that regard. We can also use sociometry to explore issues related to trust within a group. For example, I could do a spectrogram related to trust. 0 to 10, how much do you struggle with trust in your relationships? And everyone would self-assess themselves. Or I could ask 0 to 10, how trusting do you feel of the group at hand here? Or how trusting do you feel of yourself? Or how much is trust relate to your goals for recovery? And we could ask various prompts within spectrograms and sociometry to explore dynamics related to trust in the group. We can also use psychodrama or sculpting or sociodrama to explore some of the origins of trust issues for clients in childhood or in relationships. And this can be a really powerful way of embodying or enacting and revisiting, undoing and redoing moments where trust was betrayed in relationships, and giving the protagonist, the client, the opportunity to heal from the ruptures of trust in their past. In many ways, trauma is an antithesis to trust. It tends to destroy one's sense of trust in others. Trauma even disrupts one's ability to trust ourselves, to trust our senses, to trust our memories. Therefore, it makes a lot of sense that SAMHSA would elevate trustworthiness and transparency as essential for trauma-informed professionals. So, as we come to the end of this video on the second trauma-informed principle, I want to just remind you that while we're talking about these principles separately, they're all really interconnected, and we can't fully develop trust and transparency if we're not also embodying and addressing the other 5 trauma-informed principles. In terms of psychodrama specifically, this third trauma-informed principle of peer support is also particularly relevant. Psychodrama allows the protagonist to externalize parts of themselves, to renegotiate their relationships to parts of themselves, and to reintegrate these parts in a newly configured version of themselves. It's almost like in psychodrama, through externalizing parts and through role-playing, we can access a sort of peer support between parts of an individual, not just between 2 separate individuals. Other group members are inevitably going to see themselves in the roles that the protagonist puts on the stage and in the different parts of themselves. And in doing so, it's going to help audience members and the other role players enhance their own self-awareness and their own sense of connection to different parts of themselves. There's different psychodrama interventions that can help deepen our connection to ourselves. One is doubling. Doubling is the first of the developmental phases in psychodrama's child development. And the intervention is about helping the protagonist express something that's unexpressed, to label something that's been unlabeled, to find words for something that they didn't have words for previously. Doubling helps the protagonist connect with themselves. The mirror position. This is where we pull the protagonist out of the role play and have them watch the scene from a distance. It can help them reconnect with themselves, to see themselves in a new way, to develop new insight about themselves, and to offer peer support through the process. And of course, role reversal is the linchpin of psychodrama and is inherently embodying peer support, in that the role player and the protagonist and the roles as separate entities are engaging in support together. Psychodrama even allows individuals to have a conversation with different versions of themselves. So we could cultivate peer support between the protagonist today and the protagonist as a child. or the protagonist in the future and the protagonist today, and engage in a sort of reciprocal support between those roles psychodramatically. So psychodrama gives us really unlimited possibilities as it relates to redefining the self, reconnecting with the self, and engaging in peer support. There's opportunities for mutual aid in the warming up process in psychodrama, in the psychodrama itself and in action, and in the sharing portion at the end of the psychodrama, where each participant shares with the protagonist how they related to the psychodrama. The use of sociometry, which is primarily used in our warm-up phase, is ripe with social support, peer support, and mutual aid. Sociometry positions individuals in the group to be therapeutic agents for each other. And in doing so, it uncovers the different sociodynamic dynamics within the group and allows us to leverage connections and shared experience and shared identity for everybody's healing in the group. Simply put, we could say that sociometry is an exploration and realization of the potentials of peer support within groups. Psychodrama in a group process really can't happen without peer support. We have other participants in the group play the other roles in the psychodrama, and through their role playing, they're offering a unique type of peer support to their peer, who's the protagonist. Again, in the sharing phase is full of peer support in that each person is offering their own experience to the protagonist. And in doing so, helping themselves, reflecting on their own experience, and helping the protagonist and the other group members who are listening and receiving that peer support through other participants sharing. Moranian philosophy and psychodrama sociometry philosophy is really explicit in empowering each participant as a therapeutic agent for each other. Moreno writes in 1947 that one patient can be a therapeutic agent to the other. Let us invent devices by which they can help each other, in contrast to the old idea that all of the therapeutic power rests with the physician. So the psychodrama process focuses on the power of the group rather than on the power of the facilitator. And we're using psychodrama and sociometry to position individuals in ways that they can heal each other. So in psychodrama, the healing does not come from the facilitator. The healing comes from the interplay between the protagonist and the other group members and the other roles. So it's really centralizing peer support as core to the process. Of course, in thinking about peer support in psychodrama, in group therapy, and in organizations, we have to also consider the other trauma-informed principles. We really can't integrate peer support without addressing issues related to safety, transparency and trustworthiness, mutuality and collaboration, empowerment, voice choice, and issues of identity. So I encourage you to also consider these other principles as they relate. I want to talk about this fourth trauma-informed principle of collaboration and mutuality as it relates to psychodrama practice specifically. So psychodrama philosophy, psychodrama practice really inherently emphasizes collaboration and mutuality as core elements. And this is really articulated through Jacob Moreno, the founder's philosophy of co-creation and co-responsibility. So he argued that everybody in the group was co-responsible for the group and that everybody in society was co-responsible for society. And he suggested that each participant in a group setting could be a therapeutic agent for each of the other participants in the setting. And that part of our role as group leaders and psychodramatists was to create devices that positioned individuals to support each other, to collaborate with each other, and to promote healing with each other. So this is a really empowering philosophy. This role expectation that we might put on participants through this belief that each person is a therapeutic agent for every other person in the group, we're going to put a role expectation on participants, which is going to promote co-creation. It's going to help participants increase their sense of ownership over the group. Moreno went as far as arguing that the Hippocratic Oath should be extended to all patients and all participants in the group, Just like the therapist, every patient is entrusted to protect the welfare of the co-patients. He was a bit radical in his ideas, and especially in this idea, which is outlined in his Code of Ethics for group psychotherapy and psychodrama. But if you think about it a bit, it makes sense. I mean, some of the core aspects of the Hippocratic Oath, such as confidentiality, do no harm, treat everybody as equals, and use all the resources available to you to help the person in front of you, these are probably good things to ask other participants in a therapy group to commit to as well. The psychodramatic method and the process of engaging in psychodrama role plays is a very collaborative and co-created process, and it's co-created between the director, the protagonist, and the entire group. Most of the time when I facilitate a psychodrama session, I go into the group with a warm-up, and after the warm-up, I have the group propose topics, propose issues, propose goals that they need to work on. The group collectively chooses a goal and a topic and a protagonist, and we collaborate on creating some sort of psychodrama scene that addresses the issue, achieves the contract we've established for the session, and meets the goals that were articulated by the group. So it's really a collaborative process. I don't know what the topic or goal or roles are going to be before I walk into a psychodrama group. It's all spontaneously created together throughout the process. In this way, the protagonists and the group are really empowered as experts in their experience. The protagonist and the other roles in the scene are often consulted for their wisdom on where to go next in the scene. A psychodrama simply can't be facilitated without collaboration. It's such a protagonist-centered and group-centered method rather than being a facilitator-centered method. The group's collaborative process really pulls in participants as equals and as co-creators, utilizing their strength in service of the entire group. And there's really this sort of catching force that a psychodrama session has, and that even people who initially said they want to observe, they don't want to participate, they end up often getting drawn into it because of the power of it, because of the relatability of it, because of the creativity or spontaneity of it, or because of their desire to want to help the protagonist and the rest of the group. So the imprint of the past victim and perpetrator imbalance of power is naturally renegotiated through collaboration and mutuality within a psychodrama context. So as trauma-informed psychodramatists, trauma-informed leaders, trauma-informed group therapists, we really have to be integrating this trauma-informed principle, collaboration and mutuality into our work. And there's lots of different ways to do that. We're really working towards cultivating a sense of belonging for everybody in the group, everybody in the session, everybody in the organization. And I just want to remind us that this fourth trauma-informed principle, although we're talking about it on its own and separately, it's intimately connected to the other trauma-informed principles. We can't fully embody collaboration and mutuality without addressing the other principles, safety and peer support and trust and empowerment and issues related to identity. In thinking about this fifth trauma-informed principle, voice, choice, and empowerment, I want to reflect on how we can embody this specifically in psychodrama practice. So psychodrama is unique as an approach in that it really empowers participants to reclaim control of their life through role-playing, and the surplus reality of the process is inherently empowering in that it makes the impossible possible. Through psychodrama and role-playing, we enter into a different dimension where we can experience anything, even things that are impossible in real life. And this can be really empowering for clients and even for trainees in training. I know for myself in my own experience doing psychodrama as a participant and as a trainee, there were a number of psychodramas I participated in as the protagonist where there was something I was craving to experience either for my own healing or my own exploration or my own growth that would have been impossible or unlikely in real life. But through the surplus reality of psychodrama, it all becomes possible. And I can have an embodied experience of the thing that I crave to experience, or a dream or a vision that I have, which is quite empowering. Psychodrama philosophy has this belief in what we call the autonomous healing center within. And this comes from Zerka and Jacob Moreno, the founders of Psychodrama. They argue that the primary purpose of our methods and the primary purpose of the psychodramatist is to help the protagonist and the group to tap into the autonomous healing center within their self, and that this is deep within the self, usually untouched by words. And we're simply guides helping the client remove barriers to accessing self-healing, to accessing all the good adaptive information and knowledge and wisdom and strengths and resources that already exist within them. So psychodrama philosophy is inherently empowering in this way. There's a classical psychodrama motto that says, follow the protagonist, which is really promoting empowerment in psychodrama, in that we're approaching the protagonist as the expert in their experience and as the center of the group, representing the group. And the psychodrama becomes focused on them rather than on the facilitator's perception of what's going on. So this is inherently empowering. I've also suggested that the motto of follow the protagonist might be inherently limiting at times when we're doing trauma-focused psychodrama, and that it can get us into some trouble, especially if we have trauma survivors that we're working with who might struggle with containment or reenacting or re-experiencing trauma and diving into the trauma too quick, too soon, than for what is safe for them and for the rest of the group. So as psychodramatists, we have a responsibility to also provide structure and containment for the process and to keep the psychodrama safe. So I've been borrowing some language from another approach, dynamic developmental psychotherapy, and offering a new psychodrama motto: follow, lead, follow the protagonist. That, of course, we need to follow the protagonist and enter their subjective reality, but we also have a responsibility to lead the protagonist, to provide structure and containment and boundaries and keep the process safe, while also following the protagonist in what's important and what's right for them. So this paradigm really centers the client and the group as the expert in their experience, while promoting empowerment, voice, and choice. But it also articulates the psychodrama director's responsibility to lead the process, that we're not completely passive, that we also have to be active in our leadership. Sociometry within psychodrama, or by itself, is also inherently empowering and exploring voice and choice. Sociometry is really a democratic process that elevates individual choices within the group in a collective way, and elevates the individual voices within the group in a collective way. So using sociometry is a really direct and streamlined way to promote individual and group empowerment. Psychodrama elevates the voice of the group and the protagonist in each phase of the group process. In the warm-up, which is usually where we're using sociometry; in the action, if it's a psychodrama group, in the action we're doing psychodrama; and in the sharing process of the group, where each person gets the opportunity to speak up and to share how they were impacted by the psychodrama now that it's over. There's other interventions within psychodrama that really help cultivate voice, choice, and empowerment, one of which is doubling. So doubling is when we come and stand next to the protagonist and we offer a statement, something that we feel like is unspoken for the protagonist, something that would deepen the experience or label something meaningful that's going on for them. And the protagonist has the option to repeat what was said in their own words or to change it to something that is true for them. So doubling is especially empowering in that it's really promoting and role training a sense of voice, helping people use their voice to label what their experience is. Role training is another intervention that we can use, which helps with empowerment, voice, and choice. Now, role training would be where we're using some sort of future projection scene. something that we expect, a scene we expect to find ourselves in the future, or expect the clients to find themselves in the future. And we give them the opportunity to rehearse and to practice, to train in the role, so that when they go out into their lives and are faced with this situation, they already have some practice experientially responding. So this is role training, which can be particularly empowering. In client groups, this might look like practicing boundary setting with family members, and we might rehearse and practice setting boundaries with family members. In a professional setting or training groups, I often will use role training also around boundary setting. I find as professionals, we often need just as much practice with boundary setting as our clients, but also around having difficult conversations with clients, managing conflict with clients or colleagues, or asking for a raise to our supervisor, or negotiating a contract with an organizational leader. So lots of different ways that role training can be used for empowerment in client groups and in training groups or organizational settings. I find while I'm directing a psychodrama, that it's particularly helpful to remind the protagonist that they have control over this process, that if there's anything that doesn't fit for them, they can just let me know and we can change things up. If it feels like we're going too fast or too slow or a different direction than they want to go, I tell them to let me know. You have full control over this process. We're going to co-direct this psychodrama together. And then I like to remind the group about their choice to participate or not, that even if they get invited to play a role, they can respectfully decline the role if they really just want to observe. And then throughout the actual psychodrama, I like to give the protagonist as many choices as possible. Instead of being an authoritarian director and telling them this is what we're doing next, and then we're doing this, and now we're going to do this, I like to offer them options within a structure. I might say, first we need to bring some strengths and support to help us. So I'm being directive in that way. But then I'll say, which strength could help you? Which strength would you need? Pick a strength that you feel like you really need to accomplish our goal today. Or when we get to the climax of a psychodrama, right before it, I might offer multiple options for how we could interface with the issue, the trauma, and work towards the contract and the goal. Here's one option. We could have a conversation with the person who hurt you. If that feels like it's too much, another option is we could have a conversation with the part of you that was hurt, your inner child or yourself as a child, perhaps. If that doesn't feel right for you, we could have a conversation with you in the future, having healed from this trauma. We could have a conversation with your higher power, with God. We could have a conversation with the negative voices within your head that resulted from this trauma. We could have a conversation with shame that you said you've been struggling with because of the trauma. I'd like to offer multiple options, especially when we get to an antagonist role or a trauma-based role or a more intense and difficult role, to give the protagonist some choice. I find that there's multiple different ways of reaching the same contract, the same goal in a psychodrama, and that if we're creative enough to be able to see multiple options, we can offer the protagonist multiple options, which is inherently empowering. Of course, we can offer multiple options and make a recommendation. I might say, here's 3 different options that we could engage in next. The one that I think would be most helpful is this particular one. But you tell me which one feels like it would be most helpful for you. So rather than being authoritarian in our directing, it really helps to be checking in, be getting permission and consent throughout the process, asking how the protagonist is doing, and offering choices. So again, this is the 5th of the 6 trauma-informed principles: voice, choice, and empowerment. And like I mentioned earlier, we can't fully embody voice, choice, and empowerment in our organizations, in our groups, and in psychodrama if we're not also embodying the other 5 trauma-informed principles. So I really encourage you to take some time and reflect not only on this trauma-informed principle, but also on the other 5 trauma-informed principles. They really go hand in hand. And there's lots of unique ways that psychodrama, sociometry, sociodrama can be used to address the impacts of social injustice and oppression within the work. So, in this book on trauma-informed principles, there's a handful of examples in chapter 10, at the end of chapter 10, from some of the ways that I've used sociometry, psychodrama, and sociodrama within groups, within organizations, to try to address issues of identity. And I will say this is certainly an area of growth for me, and want to recognize that based on my own identities, that there's certainly going to be ways that I might be limited when it comes to addressing and thinking about and fully understanding issues related to racism and gender and sexuality and so on. So, one simple use of sociometry, simple example, to explore the group dynamics related to racism is that I could use simple spectrograms. I could do a spectrogram on a scale of 0 to 10. I could start with, how comfortable do you feel talking about racism and white supremacy? And I could ask the group to self-assess themselves on this spectrogram. And this will give us a lot of important information about the group. Then I might ask a second spectrogram prompt. How prevalent do you think racism is in our society today? And again, everyone would self-assess themselves. We'd have some smaller, maybe one-on-one or smaller group discussions about the choices. And then we could move on to a third spectrogram. Perhaps how open are you to learning about racism and what you can do to combat it and address it in your life and in your work? And we'd have everyone line up again on the spectrum, assessing themselves. So these are 3 simple spectrograms that I used in a guest lecture at a social work graduate course at the University of Pennsylvania in a course on racism and social work practice. In that same guest lecture, I used sociodrama and really short, simple sociodramatic role plays where I had individuals in the group partner with somebody else in the group. So everybody had a partner, and I assigned roles to each person within the dyad and a scene related to addressing racism, advocating for justice, repairing a relationship after a microaggression, and other scenes related to racism. Had them practice those scenarios here and now in the group through role playing. This is what we would call role training, in that we're putting group members through role plays in surplus reality, putting them in situations that they're likely to find themselves in the future, and giving them an opportunity to practice how they're going to respond in that situation through role play. Obviously, you want to be sensitive and careful and thoughtful about the roles that you're assigning and the nature of the situations that you're putting people in the role plays, and ensuring that it's done in a safe and thoughtful way. Another example comes from a sociodrama workshop training that I led many years ago. This was in the United States, and some of the political social context was that it was the height of the Me Too movement. And in this sociodrama workshop, of course, I taught about sociodrama, and then it was time to demonstrate sociodrama. And I asked the group for a theme, a topic that was on their minds that we could use for the demonstration. And the participants in the group were primarily women, therapists and students, and they chose the topic of sexism and gender violence, rape culture, and sexual harassment. So this was the theme that we worked with. And as a male therapist, a male trainer leading this workshop, primarily of women, it was really important for me to acknowledge my identity in that moment and to really empower the group to lead and collaborate and co-lead the sociodrama, as there were sure to be things that I might not understand fully or things I might miss because of my gender related to the topic. And the sociodrama emerged as a conversation between a daughter and their mother about issues related to consent and sex and sexual harassment. And so, through this sociodramatic conversation, it wasn't an actual conversation that any participant had had. It was a representation, it was a story and characters that we made up spontaneously that represented this larger social issue. And in the sociodrama, the daughter was expressing confusion about the current events and the news, about the different court cases, how men in position of power seem to be getting away with sexual harassment or even rape without accountability and punishment. And so through the sociodrama, the feelings of fear and confusion and anger and disempowerment and oppression were able to be expressed and validated through the roles. Group members offered doubling statements to each of the roles for expression. And then we got into validating the feelings, and spontaneously the role of Wonder Woman from the movie that had been recently been released at the time came into the scene to help the mother and the daughter facilitate this conversation in a way that was empowering, in a way that celebrated women and gender differences, and that promoted a sense of safety and really channeled powerful archetypal energies related to womanhood. So the sociodrama really came to a sense of closure with Wonder Woman guiding the group and offering protection and inspiration to the mother, the daughter in the scene, and to the rest of the group. So this is another example of using sociodrama to engage around issues of identity. When it comes specifically to psychodrama, there's also different ways that we can employ psychodrama rather than sociodrama to interface with issues related to identity. And I think one of the examples I could share from my own work is an experience I had working with a client who was in the midst of changing their gender, and their parent was really struggling with this. So this client had begun using they, them pronouns, and the parent was still referring to them using she and her pronouns. The father was really struggling to accept this. And the client was struggling to feel accepted by their father and really wanted to initiate a conversation and express how important this was to them. So in our one-on-one therapy session, I initiated a short role play. We would call it a role training psychodrama, where I had the client use an empty chair to represent their father and to practice having this conversation. So they were able to have a conversation with their parent, tell them how important it was that they understood or tried to understand or at least respected their requests about the pronouns being used, and they even were changing their name at the same time. And then they were able to reverse roles with their parent and just try to see the situation from their parent's perspective, which gave them more empathy and helped them develop more patience for their parent, who in this situation was really trying, but was struggling to understand. And then they had the opportunity through the role play to practice and try out different strategies for educating their parent, for connecting with their parent with empathy and love, and asking for what they wanted and what they needed from their parent. Now, this is another example of how we could use psychodrama specifically to interface with issues related to identity or gender. And there's lots of other examples that you can find of this. There's a recent book publication, Psychodrama in Brazil, that has various chapters devoted to using sociodrama, psychodrama around issues of identity. Leticia Nieto's work and her publications really emphasize using Pamela Hayes' addressing model for psychodrama directors in developing our own awareness of identities and how the group dynamics are impacted by identity. And there's been many others that have written and published about using psychodrama, sociodrama, sociometry to interface with issues related to identity. I would say many more examples come from our international colleagues rather than from the United States, though there seems to be much more interest and emphasis on identity and culture and race within the psychodrama community in the United States in the past 10 years or so. Even the history of psychodrama and the founders of psychodrama can be helpful to consider in this context. Jacob Moreno, the founder of psychodrama, was a Jewish, Romanian psychiatrist, and he was a refugee in Vienna, later immigrated to the United States. And there's even some suggestion through his autobiography that he was undocumented for part of his time in his first couple years in the United States. He writes about having to constantly go back to Canada to get a visa renewed and the complexities and uncertainties of that whole process. And it wasn't until he got married in the United States that he was able to get his license to practice medicine and start to be in the process of becoming a citizen. Zerka Moreno, co-founder of Psychodrama, the wife of Jacob Moreno, also was an immigrant from Europe. And I often wonder how their experiences as immigrants really impacted the development of their ideas and the practice of psychodrama and sociometry. Jacob Moreno was also a trauma survivor. Really, both of the Morenos were trauma survivors. In his autobiography, Jacob Moreno talks about experiencing childhood sexual abuse, really impactful abandonment and disconnection from his father. He talks about experiencing discrimination based on his Jewish heritage. And then later he shares about the difficulties he experiences in the United States based on his immigration status. English was certainly not his first language, or even his second or his third language. And I often wonder if his experience as an immigrant and as a non-native English speaker really influenced his decision to emphasize action and nonverbal communication, body language, over verbal communication in his work. Zerka Moreno also experienced adversity and trauma in her life. She was a Dutch and Jewish immigrant to the United States. She met Jacob Moreno while seeking psychiatric treatment for her sister. And I can imagine that her family would have experienced much adversity because of her sister's difficulties. Zerka was 40. She had her entire arm at the shoulder amputated because of cancer and a tumor that was forming. And I got to believe that that was pretty impactful on her life. So it's hard to discredit the identities, the experiences, the culture, the backgrounds of Jacob and Zerka Moreno, and think that it wouldn't have had any impact on their thinking and on their development of psychodrama. I think their experiences of tyranny in Europe at the time probably really influenced their focus on society, their focus on democratic group structures, healing in large groups, and their emphasis of creating new paradigms for leadership within groups and within communities and within society. Jacob Moreno actually coined the term group therapy in Philadelphia at an APA conference in 1932. And the research he presented at that conference was based on his research in Sing Sing prison in New York, where he was assessing the individual identities of each individual that was living in the prison block in the community, And he was trying to restructure and rearrange the position of individuals within the prison community based on shared identities, based on complementary roles, based on shared preferences, religion, language, profession, age, and other demographic factors. And he called this group therapy, when really the way I would think of it nowadays is that it was community work rather than simply group therapy. That he was trying to restructure communities and position community members in ways where they could be therapeutic agents for each other. And through his research, he actually used many of the identities that were outlined by Pamela Hayes in the addressing model, which I discussed earlier in this video. So I thought this was an interesting connection. Jacob Moreno and his colleagues in Hudson Valley were some of the first of the social scientists to focus on racism and racial conflict within communities and within organizations. Moreno frequently promoted sociodrama and sometimes ethnodrama as methods within his society that were designed to promote healing related to intergroup conflict or larger collective issues within society and within the culture. And there are many psychodramatists that continue this work, using Moreno's methods to address larger social issues. Sociodrama is sometimes a better option than psychodrama when working with collective issues, because sociodrama is more focused on the group's collective experience rather than an individual specific story. So in psychodrama, we're looking at an individual's specific story and experience and the specific roles and role relationships and people connected to them. Whereas in sociodrama, we're looking at collective roles, collective issues, and larger dynamics that are representative of shared experiences in a group or in a community. So there's lots of different ways we can use sociometry, psychodrama, sociodrama to explore these issues. And I encourage you to check out some of the examples in this book related to that. And there's multiple examples in my previous book, which is called Social Work, Sociometry, and Psychodrama. This book, you can actually download the entire thing for free if you search for it and go to the publisher's website, which is Springer Nature. In the later chapters of this book, there's a whole section on, here it is, part 6, sociometry and psychodrama in communities, organizations, and educational work. And there's multiple chapters here that focus on using sociometry, psychodrama, and sociodrama within communities and addressing issues related to identity and collective issues, collective trauma. So this 6th trauma-informed principle is one that I think the psychodrama community in the United States, at least, is sometimes lacking in. And I think it's one of the most important areas of growth for us as a psychodrama community, to really be thinking about issues of identity, to be centering them within our groups, to be using sociometry to explore identity within the group, using psychodrama to heal harms from past experiences of oppression or discrimination that individuals experience, and using sociodrama to explore collective issues related to identity within society and within organizations. So again, this 6th trauma-informed principle about identity can't be fully addressed if we're not also considering the other 5 trauma-informed principles. So I really encourage you to check out the other videos on this channel, the other chapters in this book, as they relate to the other 5 trauma-informed principles. I hope you found this video useful. And if you did, I encourage you to like the video, subscribe to our channel so you get notifications about future videos, and leave us a comment, leave us a message in the comments. Tell us exactly what you found helpful about this video, or if you think there was anything missing in this video and this discussion about identity. Tell us how you're using group work and leadership and psychodrama and other methods to help promote healing and safety and celebration related to issues of identity.